Health officials are reporting nearly 400 new coronavirus cases in Riverside County. 78 of those cases are from the Coachella Valley, and that brings the total number of cases in the city of Palm Springs to more than 1,000. The valley also had 5 coronavirus-related deaths. County officials will also be closing down the testing location in Indio for the weekend because of the hot temperatures. It will be back open on Tuesday. Tonight, there are new questions about a coronavirus vaccine. The CDC released a letter to public health officials across the nation calling on states to have vaccine distribution sites ready by November. That letter also advised who should be prioritized for vaccination. The CDC director says the letter is for states to be prepared for when that vaccine comes in, whether it be November or further down the line. Riverside County recently confirmed its first flu death of the season, and there is growing concern that both the flu and coronavirus could create a new hospital surge. I spoke today with one of the county's top health officials, Public Health Officer Dr. Cameron Kaiser. Dr. Kaiser, thanks for joining us.
My pleasure.
Riverside County has confirmed its first flu death for this season. What can you tell us about this? And are you anticipating more cases of the flu compared to last year?
Well, it's going to be hard to say what this really means for this year's flu season, but it's not a good start to have a death this early. We want people to keep in mind the same things that are going to protect you with COVID-19, which is facial coverings, social distancing, and making sure you avoid gatherings. Pretty much that works for other kinds of communicable diseases too, including the flu. We really don't want a situation where our hospitals happen to get hit by the double whammy of both of those occurring at once.
You mentioned it's unusual to have a flu death this early in the year. So how concerning is this for you?
Well, it makes me wonder how much of the flu is already circulating around. A lot has been said about people with COVID-19 who may not have symptoms yet, but it turns out there's also a fair amount of asymptomatic spread with the flu as well. Some people just don't get as sick as other people. And what this may mean is that this year's flu is already starting to strike in certain portions of Riverside County, and people need to be aware of that possibility.
There's concern that with both the flu and the coronavirus, sometimes referred to as a twindemic, hospitals could overflow. So what steps are you taking to address this, as well as keeping flu patients safe from coronavirus and vice versa?
Well, the first thing is that we work regularly with our hospitals to make sure they can handle that demand. What you're talking about essentially is a surge. Unfortunately, during July, we had that kind of surge with COVID-19. We don't want to see something similar occurring around the same time in the fall. The hospitals do have plans in place for dealing with this. Infection control is part of their bread and butter, and they do a very good job at that. But we're also trying to do in the community is making sure, number one, that people do get their flu shot. The new formulation should be arriving at your doctor's offices. We want to make sure that people do those necessary things to help prevent transmission. Again, making sure that you've got a facial covering, social distancing, and avoiding gatherings works for all kinds of communicable diseases, not just COVID-19. And then to make sure also that people are aware of all the risk factors that are out there, and that people who are particularly medically vulnerable, make sure that they prioritize getting those preventive measures in place.
The state recently switched to a new reopening process based on a color-coded tier system, which is not the same as the 3-phase plan that the county had proposed to the state a few weeks ago. Did the state directly respond to you about the county's plan, and what are your thoughts on the state's new guidance?
I don't know any of the details onto what the state responded to as far as the county recommendations. I'd have to defer that to our executive office. As far as what's going on right now, we just want people to be advised. We want things to reopen safely. We don't want a repeat of what happened in July. We want to make sure that our businesses and our county residents get back to work. We want to make sure it's done in a safe fashion. And I'm hopeful that with the plans in place and what the recommendations are made, that we'll continue to see improvements on our numbers so that we're able to do so.
The county's, speaking of numbers, coronavirus numbers have been trending downward for a few days now, reporting 153 cases just yesterday. Are you confident that the county may soon move into the state's next tier and reopen more businesses with modifications? Or are you concerned that both Labor Day and the flu could end up driving a spike in cases?
Well, the flu itself wouldn't necessarily cause our COVID-19 cases to rise, but I certainly wouldn't want that double impact to happen to hospitals at the same time. You know, it's going to be a slow and steady process. We are concerned certainly about holiday weekends. People come together and do gatherings. That's what we normally do, but we're not in a situation where things are normal anymore. What we do know, though, is that the state requires that you be at a tier for about 3 weeks, and you have to make sure that you've demonstrated improvement in those numbers before advancing. Hopefully, Labor Day will not cause a real kink in those numbers that would prevent us from doing so.
Looking at the national picture, there's been talks about herd immunity being used and advocated as a strategy. What are your thoughts on that, and where do you stand?
I think that herd immunity really only becomes relevant when there's actually a vaccine out there. If we're sitting there trying to depend on people's ability to build natural immunity themselves, I think we've seen, even though that most people with COVID-19 will survive, with the number of people that have died so far, it's going to still require a lot more deaths for enough people in our population to have gotten COVID-19 and be reliably immune, whatever that actually means. We still don't have a good idea of what it actually means to be immune to COVID-19, and we really don't know how long it's going to actually last. Because of that, I don't think it's realistic to say that we can depend on herd immunity just simply by allowing infections to spread unchecked in our population, because I think what that's going to end up with is causing more impact to our hospitals, unfortunately more individuals who will succumb to the infection, and we may not find at the end of it that we're substantially more immune when it's actually all over.
Early on in the pandemic, there was a lot of focus on nursing facilities and the virus spreading there. Has the county seen improvement with that?
We certainly have, through things such as our skilled nursing support systems. We've actually sent people out to facilities to help them make sure they have good plans in place, make sure that staff are educated on what the right things to do are, and make sure they have sufficient equipment to keep staff and residents safe alike. Yes, we are very concerned about in those populations. It can spread very easily with people who are highly medically vulnerable. We've responded to that very quickly. We've tried to put those plans in place very fast. And I think we've been very successful at doing so. We have substantially improved the ability of our skilled nursing facilities and long-term care facilities to care for people and hopefully keep COVID-19 out of those facilities. And we haven't had any substantial outbreaks for a while.
What have you heard from hospitals in the county dealing with the pandemic so far? We've heard here in the Coachella Valley, there's been shortages of remdesivir for patients. Is that similar countywide, and are hospitals preparing for both flu and COVID patients?
Initially, we did have issues with remdesivir shortage, but actually we're now in a situation where we have so much of it that none of the hospitals are buying up their allocations. Part of that, of course, is because the hospitalization numbers have gone down and they just don't need as much anymore. Still, though, we want to make sure that people are prepared for the fall. We know that the hospitals are trying to get their emergency rooms in order, make sure that they have sufficient bed capacity, making sure that their physicians and nursing staff and ancillary personnel are ready for it. In the meantime, we at the county are making sure that folks know where they can get their flu shots, give people the best advice that's out there, continue to make those recommendations about reducing infection and making sure that we've controlled that appropriately, and try to make sure we just don't get hit with both these things at the same time at a time of the year when we could least afford it.
All right. Dr. Kaiser, we appreciate your time. Thanks for joining us.
My pleasure. Thank you.